So guys, let's quickly talk about another concept. Concept though, known as the distended psoas bursa. Right? So you could actually have it as distended psoas bursa, or you could have it as a psoas bursitis. Okay? Anything, they actually mean the same thing, all right? Anytime you see teeth, just know that there's what? Inflammation. Okay? Bursitis, different things. Okay? Nephritis and the rest. Okay? So talking about psoas bursitis or the distended psoas bursa, we get to talk about the definition, talk about the causes, talk about the symptoms, talk about the treatment of this medical condition, right? So for the distended psoas bursa, also known as what? Psoas bursitis, just simply just right, there's inflammation in the bursa that is found in the psoas, right? Maybe region where you find the psoas muscle. So there's a bursa where the psoas muscle is passing on it, right? So if you overwork that area, you have an inflammation. Okay, that's simply the story. So it is also known as psoas bursitis. It is a condition where the bursa, and the bursa is a fluid-filled sac that surrounds the psoas muscle in the groin area, becomes inflamed and fills with what? Excessive fluid, leading to swelling and pain. All right. I got to know about this distended psoas bursa when I was still treating all those femoral hernias, right? And I got to see that one of the differential diagnoses for femoral hernia was actually this distended psoas bursa, right? So that's why I said let me just do more research on it. So what could be the possible causes, okay, that will make the psoas bursa to become inflamed, to become filled with fluid, and to swell up, okay? It could be due to overuse or strain on the psoas muscle. Be that probably you overwork the strain muscle, the psoas muscle. Okay, be that maybe you climbed too many upstairs, you did a lot of exercise. Okay, right? Too much sex too, right? Then if you have a hip or groin injury, can also cause this. It could be infection directly from all those microorganisms. All right, then inflammatory conditions like what rheumatoid arthritis can also cause this. What will be the symptoms? We're talking about inflammation, we're talking about redness and all the stuff, okay? Definitely, pain and swelling will be there, all right? So there'll be pain and swelling in the groin and thigh, all right? If there's swelling, if there's inflammation, the place will be warm, okay? So the place will be warm. And when you try to touch it, it will be so soft and the patient will shout, okay? So that's the warmth and tenderness in the affected area. There's limited mobility and stiffness in the thigh and hip because this place is paining you. You don't want to use it too much again, all right? And snapping and clicking sound with movement in some cases, all right? At the treatment, you can rest or you can ice the place. All right, put some ice there. All right, chill down. The physical therapy to stretch and strengthen the surrounding muscles. Then anti-inflammatory medications like what? Non-steroidal anti-inflammatory drugs, okay? Then antibiotics if you suspect that there's possibility of an infection or there's already an infection, all right? Then corticosteroid injections in some cases, all right? Surgical drainage or removal of the bursa, that's in severe cases. So it is important to seek medical attention if you experience persistent pain or swelling in the groin area, as distended psoas bursa can lead to further complication if left untreated, right? So early diagnosis, early chances of what? Recovery. More chances of recovery, sorry. Right, so that's it about the distended psoas bursa or psoas bursitis. Okay.